Welcome, my name is Peter Strong. I'm a professional online therapist specializing in mindfulness therapy for the treatment of anxiety, including panic attacks and other anxiety disorders such as agoraphobia and social anxiety disorder that benefit from mindfulness therapy. So I specialize in mindfulness therapy, which is a system of work that I have developed over the last 10 to 12 years now that is proving very effective indeed for helping people overcome anxiety and panic attacks. So if you're looking for online treatment for panic attacks, then I encourage you to read more on my website, and please feel free to contact me with any questions that you may have. And when you feel ready, we can schedule a Skype therapy session. So Skype therapy for panic attacks is very convenient, of course, means you can have your sessions at home without having to travel to a therapist's office. And often for anxiety disorders in general, the online format is typically much more comfortable for you, much less intimidating, much less clinical in nature. So mindfulness therapy is not a clinical approach to treating anxiety or depression. It's a system of teachings. It's a way of giving you practical methods that you can develop and apply yourself for overcoming anxiety and panic attacks. So one of the most important methods that I will teach you is how to change the relationship that you have with your anxiety. This is really quite important. So from a mindfulness psychology viewpoint, anxiety is regarded as a habit, a psychological habit, rather than an illness or a disorder. So the real problem with anxiety is that these habits become established and they operate automatically out of consciousness. And the first training in mindfulness therapy is restoring consciousness so that you develop a very conscious and non-reactive relationship with your anxiety, with your emotions. This is quite important. You really cannot expect those habits to change until you develop a conscious relationship with them. So the way we do this is by, quite surprisingly perhaps, choosing to meditate on the anxiety or other emotions. We make them the object of meditation. This means that we focus a great deal of conscious awareness on the emotion itself. We might play through a scene in the mind where the anxiety may be triggered, but then we work with that anxiety, restoring consciousness. So that means that you can observe the anxiety or any other emotion without becoming reactive, without becoming identified with that emotion, without becoming consumed by it, or overwhelmed by it, or lost in all of the related reactive thoughts that tend to feed anxiety and panic attacks. So that's a very important part of the training, learning to sit with your emotions without becoming consumed by them. Then, when you have established that conscious relationship, then you can begin to change the emotion itself. We can help it heal. So that's the second primary theme in mindfulness therapy, is teaching our emotions how to heal themselves. It's about healing. And one of the most important requirements for healing is that conscious relationship itself. In essence, you become like a parent to the anxiety, which is like a child. It's a conscious relationship, and it's also based on love or friendliness, with an interest in the anxiety and helping it heal. So that relationship gets fractured during anxiety disorders. We say there is a disconnect between your true self and the emotion. That's like a separation between the parent and the child. And then the anxiety becomes isolated, and it just becomes a source of reactivity, and it cannot heal without that connection with your larger and higher true self. So that's what we establish during meditation on the emotion. We re-establish the relationship between your true self, which is the observer, and the anxiety, which is the object observed in your meditation. So that relationship is fundamentally important for healing, as it would be for a child that was in pain. It needs to reconnect with its parent, with consciousness and love, in order for the child to discover how to heal its own pain. So this way that we help the emotion heal is also depending on the working with the imagery of the emotion. So any emotion has associated imagery. That's what really keeps that emotion operating in the mind. And when we are meditating on the emotion, we want to explore this imagery, because when you change the imagery of an emotion, the emotion heals, it changes. So we look at the position of the image, of the emotion. That's really important. So many people experience the anxiety in their body, in their throat or their chest. That's quite a common position, and that's part of its structure, that's part of its imagery. It needs to be in that place in order to create the emotional distress of anxiety or panic attacks. So when we see its position, we then start to explore moving it. And this is a very, very effective approach to working with anxiety and panic attacks, particularly, which are simply a very intense form of anxiety. When you can learn to see the anxiety clearly as an object, and then move it from its habitual position in the chest or the throat or wherever it may be, to a new position, typically outside of the body, that movement is a very important part of the healing process for the emotion. It has to move. It has to change its position, and you can help it do that through meditation. That's a primary function of meditation, is to facilitate healing That's the primary purpose of meditation. But we can also work with other components of the imagery of the anxiety, such as its color or its size. What color is it? This is something that's really important. Most people find that the color that best resonates with their anxiety is usually red or orange, and that color is part of its structure. It has to have that color in order to create the feeling of anxiety. But it's all habit-based. Now, when we bring conscious mindfulness to the emotion, we can investigate its color and we can begin to change its color. Because when you have consciousness, you always bring with that consciousness choice. You can begin to explore changing things. They are no longer in the habit realm. So we explore changing the color and make the anxiety blue or green or any color that feels right. Explore what feels right, what helps that anxiety heal. We look at its size. Clearly, if it's very intense, the emotion must be very large. So, again, its size is a product of habit. It simply takes on that form that's very large, with that certain color and certain position, out of habit. So the size we can change. You can shrink an emotion down. You can make it as small as you need to make it. And you experiment and you explore what happens when you shrink the emotion. Make it as small as a grain of sand. See how that affects the intensity of the anxiety, of the panic. So there are many other components like that in the imagery of the emotion that we can work with quite effectively using mindfulness therapy. If you'd like to learn more about how to work with your panic attacks and anxiety using mindfulness, then please reach out to me by email, contact me, and let's schedule a Skype therapy session. So I see lots and lots of people who suffer from panic attacks and anxiety in general. And this approach is very effective, and most people see quite substantial improvements within just a few sessions. It's much better than using medications. Medications will do absolutely nothing to change that underlying habitual process that causes your anxiety and panic attacks. It only provides a temporary relief from symptoms, and we want to do better than that. We want to change the underlying cause of your anxiety, and that cause is, as I said, primarily a function of imagery and the relationship that you have with the emotion itself. So when you correct both of those things, you produce a very effective change in the anxiety, and you will help it heal very quickly. When you have shown the anxiety how to heal itself by changing its imagery and by creating that parent-child type relationship with it, then that becomes a new habit. It becomes automatic, and the anxiety can heal itself once that new positive habit has been established. That's what's so nice about this approach. It's basically learning how to help your emotions heal, and how to develop what we call resolution pathways that help them heal by themselves. And it's very, very effective. So if you'd like to learn more, please contact me. Tell me more about yourself and your needs, and let's schedule a session. You'll see for yourself in the first session just how effective the mindfulness therapy approach can be. It's one of the most enjoyable ways of working with emotions in general. It unleashes a lot of energy that gets trapped in those contracted emotions like anxiety and panic or depression as well. So if you'd like to get started with me, please contact me. Thank you.